why does the front of the knee hurt when you go downstairs? And why does the knee kind of give out or feel like you just don't trust it to put your weight on it? That explained, and how to fix it coming up next. Hey FreeBody family, Kat Matlock here in beautiful Asheville, North Carolina. And I'm working with a client online through a telehealth thing who is having some trouble with his knee. And he was worried that he was going to need surgery. He's worried that he wasn't going to be able to continue playing ball and running. And so we're coming up with a plan. And I just wanted to help you understand this pattern because he's having a lot of knee pain. And it's hard for him to go downstairs or go down hills, and it feels like the knee can't hold his weight. Well, it's actually a pretty simple fix, and I want to explain this to y'all because I'm guessing a bunch of you are having this problem also with this front of the knee pain and knee buckling, which can also actually feel like front of the thigh pain. Maybe when you lay down at night and you kind of straighten your leg out, you might be like, oh, that actually hurts. It feels like my quads hurt. And you might be actually rolling your quads and it's not fixing it. So I'm going to help you understand why that's not working also. The thing is, the rectus femoris is one of the quadriceps muscles. It directly causes that front of the knee pain and knee buckling, especially when you're going down the stairs or down the hill, and it will make you not trust that. If you're going down the stairs, you might, if it's happening in the right knee, you might kind of step down with the left and then bring the right to meet it, and step down with the left and bring the right to meet it. Anybody relating to this way of doing things, right? Because you just don't trust that leg. You don't want to fall down the stairs, of course. And what I see a lot of times with people with knee pain is that they tend to think, oh no, it's in my knee. I must need like surgery, or I might need a knee replacement, or I might be losing cartilage there. I'm going to either ignore it for a while and try to avoid that surgery, or I'm just going to go down that road with orthopedic surgeons and whatever. And then sometimes it doesn't even fix the pain because it actually wasn't a knee structural issue. Sure, you might have some loss of cartilage in there. Sure. But we all do as we get older, and it doesn't mean that that's actually causing your pain. Where this pain is coming from, most of the time, if you have this conglomeration of symptoms, which is front of the knee pain, kneecap pain, giving out of the knee underneath your weight, maybe aching at the front of the thigh when you lay down, all of that is coming from rectus femoris. So this rectus femoris, also being a quadricep and a hip flexor, is really prone to a lot of issues because it does those two very important jobs: straightening the knee like all the quadriceps do, and then also drawing the knee toward the chest, which is what the hip flexors do. So if there's any dysfunction in any of the other quads or any of the other hip flexors, the rectus femoris might be kind of taking up extra of that job, of that work, to compensate for the sort of disabled or dysfunctional other muscles in the groups that it works with. So it's going to be beneficial for you to treat all the hip flexors and treat all the quads. Great. Okay. That is still not going to do it. It's still not going to fix it to just treat the hip flexors and treat the quads. Why? When a muscle is crying out in pain, it's the end of the tensional line, not the beginning. No muscle works in a vacuum. The muscle that's crying out in pain is almost always the end of the tensional line, not the beginning. So if you're a body worker or a physical therapist and you're watching this and you're thinking, oh, I'll just treat the rectus femoris and that'll make it go away. No, it won't. It's not going to work that way. You have to treat the opposite muscle groups. The opposite muscle groups to the rectus femoris are the knee flexors and the hip extensors. Turns out the hamstrings are both of those things. The hamstrings bend the knee, the quadriceps straighten the knee. The hip extensors bring the thigh back behind you. The hip flexors draw the thigh forward and up toward your chest. So usually I'm highly successful, and this guy I'm working with telehealth online is already feeling better after just treating these tissues in the right order One time. One time he treated him. He was able to bend his knee so much further. He was able to get out of pain already to a degree just from doing things in the right order. Treat your hamstrings first, treat your glute max first, and then release the rectus femoris. Doing things in the right order will always help. So you're going to treat the hamstrings. If you're a body worker, you're going to get them face down. You're going to release their hamstrings. You're going to release their glute max. And then you're going to turn them over and release this very particular point in the quads in the rectus femoris. Okay, I trust you found this video to be helpful. Here's the key takeaways. Knee pain at the front of the knee that causes buckling like it gives out while you're going down the stairs or down hills, that makes you not trust putting your weight on your knee. It might also hurt going upstairs, but it's more prominent going down. 100% is coming from your rectus femoris muscle, which is a quad and also a hip flexor. No muscle works in a vacuum. You must release the opposing muscle groups first to be able to effectively treat the rectus femoris. The opposing muscle groups: hamstrings and glute max. You can get on the balls like I showed you. You can use your percussion massager like I showed you. Once you release them, then the rectus femoris goes, oh, okay, now I can shift. Of course, one hip being higher than the other, like I talk about a lot on this channel, can be a piece of this puzzle, can be participating, but getting into those hamstrings and glute max first is essential. Then that upper point, that spot right here, rectus femoris, right at the front and a little bit to the side, that's the tension that's causing that knee pain and knee buckling. Thanks so much for watching. If you got something new out of this, please like, subscribe, put a comment below. Send this to somebody with knee pain who's going, I think I need knee surgery. Let them try this first. It's certainly not going to hurt, and it might save you or someone else from having an unnecessary surgery. I'll see you in the next video.